Hello and welcome to Take Your Medicine. Today's show deals with a chronic disease that affects almost 500 million people worldwide. This disease is diabetes mellitus. So what is diabetes? It is a metabolic disease that causes high blood sugar levels. The hormone insulin moves sugar from the blood into your cells to be stored or used for energy. With diabetes, your body doesn't make enough insulin or cannot effectively use the insulin it does make. So insulin is a transporter that carries sugar molecules from the blood to the organs, tissues and muscles. When the sugar does not get transported from the bloodstream, its concentration in the blood increases and then starts causing damage to your nerves, eyes, kidneys, fingers and toes and other organs. Let's see how this looks like in theory. In the video on screen, in both glasses we have water that represents the blood in our body. In one glass we have sugar that has dissolved in the bloodstream. This represents normal blood glucose concentration. In the other glass you will notice that there is sugar particles at the bottom of the glass. So why is that? Since the insulin can't carry the sugar particles to the various organs and tissues, the blood sugar concentration increases until the blood can't dissolve the sugar anymore. Now the sugar particles travel in the bloodstream, causing damage wherever they go. In practice, we see the areas with the smallest blood capillaries, that is, the areas of the eye, fingers and toes, are the areas that get damaged most commonly. This leads to poor blood circulation, which leads to less blood passing through these areas. This causes poor healing and nerve endings begin to die, as they are not well nourished by adequate blood supply. This is what causes the burning sensations or sometimes loss of feelings in these areas. Symptoms of diabetes are increased hunger and thirst, weight loss, increase in frequency of urination, blurred vision, extreme fatigue, and sores that take long to heal. In men, low libido and poor muscle strength, and in women, increased occurrences of urinary tract infections, yeast infections, and dry itchy skin. There are different types of diabetes, namely type 1, type 2, and gestational. Type 1 is the result of the pancreas failure to produce enough insulin due to the loss of beta cells. Type 1 is also known as insulin-dependent diabetes mellitus or juvenile diabetes. So the loss of beta cells is an autoimmune response whose cause is still unknown. Children and young teens are commonly diagnosed with type 1 diabetes. It is usually caused due to genetic factors. Type 2 diabetes is the most common type worldwide. It begins with insulin resistance, which is a condition in which cells fail to respond to insulin properly. As the disease progresses, a lack of insulin may also develop. The most common cause is a combination of poor diet, an increase in body weight, and insufficient exercise. Gestational diabetes is the third form of diabetes and occurs when pregnant women without a previous history of diabetes develop high blood sugar levels. Type 1 diabetes is managed by taking insulin injections. In type 2 diabetes, the first-line treatment is a balanced diet and exercise, keeping your weight to normal BMI levels, and avoid tobacco and alcohol use. Type 2 diabetes may be treated with medication such as insulin sensitizers and with or without insulin. Controlling of blood pressure and maintaining proper foot care and eye care are important for people with diabetes. Gestational diabetes usually resolves after the birth of the baby. I hope you guys have enjoyed today's show. It's just to give you a basic understanding of diabetes and what it is and the different types that you will encounter. If you have any questions, please leave them in the comment section below, and also don't forget to hit the like button and also subscribe to the channel. Thank you for joining me. Take care. Goodbye.